What questions now do you guys have for me? What would you like to know that I haven't shared with you yet? Anything at all?
How many doses do you take a day?
Okay, so that's a good question. Everybody's different. Here's one of the very interesting things about it. It's not a pill. It's not a circumstance where I can say, take 2 of these and call me in the morning. Everybody's body is different. Some people with, I'll use milliliters, that's an amount. Someone might, person over here might take 5 milliliters of the solution and instantaneously have a dramatic effect and feel totally different. And that might last that person for 4 hours. It might last for 6 hours. It might last for 8 hours. Another person, it might take 7 milliliters to do the same thing. And some people, 7 milliliters will only last 4 hours. And so what the doctors do at our clinics is they work with the patient over a period of time. And the titration, meaning the dosage, that we recommend to patients is relatively high in the 6 or 7 milliliter range, typically 3 times a day for about a week. After that, after 3 to 5 days, the doctors see those patients back again. They look at the catalog of the titration, meaning the amount of times they've taken the solution and how much what the intervals were. They try to dial in how the body's responding, how the body's actually receiving it, at what rate, what the pain, is the pain returning at 3 hours, 5 hours, 7 hours? Not at all, whatever it is. Once we titrate over a period of time, we get a little bit of a record of how someone's doing. And then what we do over time, over a 3, 4, 5, 6, 8 week period, is we slowly bring the dosage of that titration down. So it's, and again, everyone's different. You know, if you responded, you may start at 6 milliliters today, and 12 weeks from now you might be at 2 milliliters. Many people at the 6 month, 7, 8 month mark are really living back to a normal life and not taking sometimes any. Once the body figures out how to do this again, it begins to do it naturally, and the long term is it's not designed to be something that you'll have to take for the rest of your life. It's something that will help your body restore some of the vital elements within it, so your body can do these things on its own. So, does that answer the question? Do you have another question?
If someone is taking natural supplements as opposed to pharmaceuticals, will this also help?
I would say without regard to what anyone is taking, I guess what I would say to answer the question is if someone's taking holistic, or if they're taking a type of a supplement and or on a medication, will this have an impact? What I will say is those things, the medications, the other substances, won't have an impact on whether this will work or not, nor will this interfere with what they're doing. They're totally separate entities unto themselves. Our recommendation is for any patients that we see is to, obviously, the advice of any prescribed medications that you are taking. Obviously, we want the patient to stay on those prescribed medications for a period of time, until which time they believe as a patient that they feel they may not need those things. At that time, we would recommend that they would see their primary doctor, or the doctor who would prescribe those medications, and ask them to slowly back them down from those narcotics, for example. And the reason is we've had patients historically who have done this, and they feel so good 3, 4, 5 days, they stop taking their meds, because they don't have any pain anymore. They're not hurting. The challenge with that is that once you do that, you're really setting your body up for failure in yourself, because your body's going to have, for many of these things, a withdrawal symptom. Many of these things that are prescribed for these conditions really require a very well-skilled and trained doctor who prescribed the medication to help the patient bring that dosage down over a period of time, so they don't cause other problems within the body. If you quit taking all the medications, I guarantee you'll have some withdrawal symptoms. The patients that we've done this with, and history tells us that we want to be very clear not to make any changes, because when you do, you might not feel well, and then you'll say, well, geez, the solution's not working, I feel worse now. So we don't want that either. We want a very steady progress, and we want to see the improvement over time, and we don't want to be able to associate hills and valleys with anything other than natural and normal body healing process, which we see anytime the body's going through this type of change. So, question? Other questions?
Do you have offices around here?
We do, in fact. One of the very first offices in the entire Northeast is about 2 miles from here. It's, if you head back down Route 31, there's a big golf plaza on the right-hand side, I believe. On the other side is Syracuse Medical. And they were the first Northeastern practitioner and have done very, very well with the solution. They've done great with their patients. They're a really great testament to a practitioner that cared. We selected them for a number of reasons. Number one, this condition is not easy. Not easy for those of you suffering, and it's certainly not easier on the doctor. Can you imagine being a doctor seeing lots of you every day? When you got into a business, all you wanted to do is figure out how to help people. And now you're seeing people and you just can't figure out a way to help them. So from the doctor's perspective, this is really tremendous, because he had a number of patients that were struggling for years and years and years that we brought in. And nothing made him happy to see those patients get well. So yes, and Dr. Gardner, his office is just down the street. So. That's your question. Other questions?
Is it expensive?
There is an expense to it, depending on your circumstance and or your situation. We'll talk about that process, but let's talk about that in the way of understanding the time at the office. So the first thing that would happen is we want to test everybody. We have a test, a methodology in which we go through, which we'll go through. If we were to do that, is there anybody in the room that would like to go through the test today? Okay.
Sure.
All right, so if you did, we'll do that in a moment, and that way you'll see what it is. The doctors and the staff and or the office staff are going to ask a lot of questions. They're going to ask all the normal intake paperwork questions. They're going to find out about your condition, symptoms, things that are going on in your body, and really devise a plan that may incorporate multiple things. There may be some obviously the solution, if that works, that's the basis for which. There may be some additional dietary elements that can be identified that can additionally help. There may be some other recommendations that wouldn't necessarily mean you need to come to the doctor's office. But really, the program is designed to help you get well and support you getting well. So the first thing that happens is we look at the background of the individual, try to understand what's going on. And we have to make a decision, okay, does it make sense to put this person through the test? Typically it does, because the people who come in are suffering with the conditions that we have talked about and or they've read about in connection to the solution. Then we basically sit them down and we do a pressure sensitivity test. Who's ever had a pressure sensitivity test whereby the doctor has pressed 18 points on your body, which is the way in which you get a diagnosis of fibromyalgia. The condition fibromyalgia is placed upon you if they press on those 18 spots, and I believe it's either 10 or 11 of those spots over a certain period of time have an unusual response to pain. So if you've had that test, you know what it's all about. So we're going to do that test as well. The difference is that we're going to actually catalog. We're actually going to study the results of the test. So element one is we press on those 18 locations on the body, pretty simply, and we catalog that. We catalog that in the iPad. A little drop-down menu pops up and we put the number. You're going to rate as a patient from scale to 0 to 5 how much pain you felt. And the doctor, or depending on the staff member, whoever does it, anyone can do the pressure sensitivity test. They're going to put about 5 pounds of pressure, even pressure, on palpate. That's the term for that. They're going to put about 5 pounds of pressure on those locations. And the patient's going to say that was a 5, or that was a 1, that didn't really hurt too much. And we'll go through those 18 spots. Then what we'll do is we're going to take 2 drops, little droppers of the solution, which I'll show you here in a second, and put 6 milliliters in a cup and drink it down. And we're going to wait about 6 or 7 minutes and test those points again. So that's as simple as it is. Do you think you'd like to do that?
Yes, most certainly.
All right. So why don't we do that now?
All the other fibromyalgia medicine is on my allergy list.
Yeah. Do you have a lot of allergies?
No,
All right. So a question that I would ask, if you don't mind me asking you a question, do you have any active ulcers or anything like that going on? The only thing that we always want to be conscious of is if somebody has ulcers or if they have acid or anything like that, reflux, those types of things, they only because it can sting. Just like if you eat a bunch of pasta or something like that. It's probably no worse than drinking a Mountain Dew, but and I see you have one there. So if you're willing, Patty, if you would if you give her those forms.
Sure.
I just need you to sign off a consent form. There's the complete ingredients and that kind of thing on there, Patty. If you'd hand her that, I'd appreciate it. Sign that, and then we'll have you come up and we'll run the test on you. In the meantime, are there any other questions?
Have you, in learning about all of this, have you been told that it's hereditary?
We don't have a clear connection, and the brutal truth of it is that the path of understanding for what's really going on in the body is not as clear as we'd like it to be. It's not as clear as we'd like it to be as it relates to exactly how this works. We just know it works. It works very quickly. It works very, very well, and it gets people moving in the right direction. The patients that we have at 3, 4, 5 years out are literally from where you may be now to back to a normal life, the life that they had before this started. It's really wonderful. Now, for a couple $100 million, we could figure the mechanism of action. We could figure that out. The challenge of doing that, of course, is that the cost of putting those studies together, the cost of doing that on a product that an individual is only going to take for a very short period of time in their life, the ability to pay for that research, unfortunately, comes down to dollars and cents. You could never make the money back. If it were a type of a thing that somebody was going to take 2 pills a day every day for the next 25, 30, 40 years, well, then the payback is there, such as it is with a pharmaceutical, whereby somebody starts taking a pill and they take it for 30 years. And the prescription's, a couple $100 a month, and you got a few million people doing it. This doesn't have that ability. It's really not designed to do that. It's designed to make people's body do what they should be doing. So, any others?